The next technique I will be using is the trigger points. Remember that for trigger points, there are multiple ways of treating it. You can treat it with muscle stripping, ischemic compression, and pincer grasp. You don't have to really overthink it so much. Just pick the ones that's appropriate with the areas that you're working on. For example, maybe pincer grasp is good around SCM, right? Or ischemic compression would be good in an area like the QL or the lower back, or maybe the best one to do for the neck would be muscle stripping, right? So there are 3 versions of it. I will show you the ischemic compression though, as it's the most common one. And again, trigger points are used to treat hyper-irritable spots, or it's also called as knots, and then it might add to the pain. That's why the gist is we press it until it's gone. Or you press it for a minute until it feels less. So an important thing that you should not forget when, doing this technique is providing them a pain scale, okay? And my suggestion, the common pain scale that I see is just saying, I have a pain scale of 1, least painful, 10 is the most painful, and then nothing in between. My suggestion is add something in between, because my 7 is not your 7. My 5 is not your 5. So, how am I going to explain it to the client? So, let's say you did your warm-ups. Then you did your stripping and you found a knot. Let's say we found a knot here on the same area where I'm treating right now, which is let's say the rhomboids area. Yeah? So, while I'm treating it, so, John, I did find a hyper-irritable spot in this area called knot. It's probably causing the pain that you're feeling right here. I'm going to treat it using a trigger point, okay? So I'm going to give you a pain scale of 1 to 10, 1 least painful, 10 most painful, 7 tolerable pain. And I'm going to press it until you feel that it's 7. I'm going to hold it for a minute until it goes down. And then after that, we're going to see how it goes, okay? So now let me find the knot again. So let me start the technique. Okay, so we assume that it's already here. So after your warm up, because you found the knot, warm it up more. Once it's warm enough, then you can start asking for the pain scale. You start looking for it again. Okay, so now I found the knot. I'm gonna press it again. Is it a 7?
No.
It's a 7. Is it a 7?
Yeah.
It's a 7. Okay, so now I'm gonna hold it for a minute. Let me know if it goes down.
Yeah.
How does it feel? It goes down?
Yeah.
Okay, relax. I'm gonna release it a bit, but I'm not gonna let go of the position. Now I'm gonna press it again, and then let me know if it's a 7. Press it again. I'm on the same area.
Yeah.
Is it a 7?
Yeah.
Okay, I'm gonna stay. Let me know if it goes down. It goes down now. Okay, let me release for a bit. Let me do it one last time. Okay, let me press it again on the same area. Is it a 7?
Yeah.
Okay, it's a 7. And then let me know if it goes down.
Yeah.
Is it down? Okay, I'm gonna release it. After that, I'm gonna flush the area, and then I'm gonna stretch. So you can't do fascial stretch for this, but I'm gonna do a stretch. You feel the stretch at the back?
Yeah.
Okay, I'm gonna hold this for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do you feel the stretch? No pain or discomfort?
No.
Okay. Alrighty. Then technique is done.
Okay.
So to summarize, okay? To summarize, the technique is, okay? Warm up. Find the knot. Once you find the knot, give them the ischemic compression pain scale. 1 is the least painful, 10 is the most painful, 7 is tolerable pain. Once you have established that, find the knot again, then start pushing, holding it in for a minute or until you feel that the pain scale is less than 7. Then release it a bit. Release it a bit. Don't remove your hand. Just touch it. But don't be like, okay, out, totally out. Just push, move it up a bit. But don't remove your hand there because you're gonna lose the knot. Do it for at least 2 to 3 times. I did 3 times for the sake of showing. Once you feel that the knot is there, you do the flush, quick flush, and then you do the stretch. Just to show you of how in depth would it be. So if I press this, you see that there's a dent. Yeah? Because I'm pressing. So after that, if he says, oh, it's lesser, I'm just gonna release it a bit. But I didn't take off my hand. Then I'm gonna ask, okay, I'm gonna press it again. Go to a 7. Some other versions would be, I was taught, that's another version that I was taught with. Another version that was given to me is that if I press it as a 7, I wait until I feel that it's less. I don't remove my hand and then I keep pushing more.
Yeah.
So my suggestion is pick whatever. I think it's the same thing anyway, as long as the flow follows. So what's the flow for trigger point? The flow for trigger point is you warm it up first. Once you warm it up, find the knot. Once you find the knot, you tell them that it's a hyper-irritable spot. You're going to treat it using trigger points, and you're going to give them a pain scale of 1 to 10. 1 least painful, 10 most painful, 7 tolerable pain. Find the knot again. Treat it with ischemic compression, muscle stripping, or pincer grafts. Hold it. Right? Once the symptoms are less and you feel that it's getting better, once you feel that that's it for the patient, you can go and flush and then stretch. Now, the minimum for other people is 30 seconds of stretch. For exam purposes, you can keep it for 10 seconds. Because the number of stretch is very subjective. It's not really mandatory to be 30. It depends on the body, right? Like for example, if I'm very flexible, 1 minute is probably my least minimum. But then if I'm very tight, 30 seconds would be excruciating. You know what I mean? So my suggestion is keep all your stretches from Remax to techniques 10 seconds. Strengthening can be 7 or 6 seconds. Okay? Any question for trigger points?
So, do you think I should hold the trigger point for actually a minute in the exam?
If you use the time-wise, you have to do it. Other method I would say is if you're very anxious with time, I'll just ask by feeling. Because sometimes it doesn't really take, sometimes, not all the time, sometimes it doesn't take a minute for them to release. Like sometimes within 30 seconds, it's gone. So that's why the version I showed you, as I said, I'm going to hold it for a minute or until you feel that it's gone or it's less. So I'll go with feeling maybe. Okay? Any questions? Oh, another thing. I did a mistake. I was talking and then I stopped moving. My suggestion is talk and move. You can even do some palmar stripping as you explain things to the client, as it's also a form of warm-up anyway. And again, no heat pack required for this, as that's subjective.
I don't even have to say it?
No. I've read a part of that book saying, like for example, for frictions, they actually said that in the first version of the friction technique, they really didn't need the ice at the end. But the newer version said ice is better. So it means it doesn't really matter which one, as long as the core technique will be there. Okay?
Sorry, for trigger points?
No, for trigger points, friction, yeah, it's subjective. The heat is extra. The hydrotherapy is extra.
Okay, should I say it though, even though
No.
I'm not doing it? Like,
No.
should I say normally I would do this, or?
No. I mean, they said it already. You don't need it. So you don't even have to mention it as well.
Okay.
Okay?